Hello, and thank you for joining today's webinar, Walk in Our Shoes, the Experience of Rare Disease Patients. My name is Katie Kowalski. I work in the Education Department at NORD, and it's my pleasure to be your facilitator for today's event. This webinar is the last of our three-part series exploring disparities faced by rare disease patients from underserved groups and the role healthcare providers and health systems and the rare community can play in addressing issues of health inequities. NORD's pleased to work in partnership with the Rare Disease Diversity Coalition to produce these webinars. RDDC addresses the challenges that marginalized populations face, obtaining diagnosis and accessing treatment for rare diseases. They aim to educate and empower rare disease patients of color, reduce the time between the onset of symptoms and diagnosis, and eliminate racial bias. Thank you, Rare Disease Diversity Coalition, for your support. We know that rare diseases do not discriminate, and their impact is felt by people of all genders, ages, races, ethnicities, socioeconomic statuses, religions, and sexual orientations. NORD's dedicated to working with stakeholders across the rare disease space to build a more equitable future for every person living with a rare disease. As part of that effort, NORD has created toolkits aimed at helping advocacy organizations foster diversity, equity, and inclusion in the rare disease nonprofit sector. To access the toolkits, please visit our website at rarediseases.org/diversity, equity, inclusion. And now it's my pleasure to introduce today's moderator. Beverly Francis Gibson is the CEO of Together Women Rise, an organization dedicated to achieving global gender equity. Beverly has served nonprofits and community foundations for over 25 years, and she spent 10 years as the president and CEO of the Sickle Cell Disease Association of America, where she was a fierce advocate for patients living with sickle cell disease and other rare disorders. I've asked Beverly to also participate in today's discussion and share experiences from the sickle cell community. So we welcome you, Beverly, and we're so pleased to have you with us today. And I'll let you take it from there.
Thank you, Katie, for that wonderful introduction. It is an honor for me to serve as moderator for today's session, Walk in Our Shoes, the Experience of Rare Disease Patients. With me today are Dr. Brittany Claiborne and Melinda Sastoume, who will share stories about their lives and what living with a rare disease is like for them. At this time, I'd like to invite Dr. Brittany Claiborne to join us and to share her story.
Thank you so much, Beverly, and thank you, NORD, for having me here today. My name is Dr. Brittany Claiborne, and at the age of 26 and in perfect health, I was having a baby. And during my labor, I experienced heart failure. About 3 days after being released from the hospital, I was returned to the hospital in complete heart failure and diagnosed with a condition called peripartum cardiomyopathy. The peripartum cardiomyopathy journey is something that women usually recover from very soon after the birth of the child, usually between 3 weeks to 6 months. I went on to need not only a mechanical heart, but also a heart transplant.
Thank you, Brittany. Next, we're going to invite Linda to join us and to share a little bit about herself and her journey.
Hi, everybody. Thank you so much for having me. My name is Melinda Sastoume, and I'm originally from Guatemala. I'm 21 years old, and the disease that I have is called HS. I cannot pronounce it, but I'm gonna try. It's called hidradenitis suppurativa. I was diagnosed with this when I was 13. Well, actually, I didn't get the final diagnosis when I was 19. My mom, my sister, and I, we moved here about 6 years ago. But everything actually started when I was only 13. Everybody thought it was just like little bumps, nothing too crazy. I was only 13. So we didn't like pay too much attention to it until I moved here and things started to get very complicated. My bumps were draining like all the time. I was in pain 24/7. So I finally got into like somebody who actually knew what was going on with me. And that was not until I was 18. So between I was 13 and 17, I was just taking medicines and I'm going to the doctor without knowing what was going on. So until I was 18, they actually told me what was going on in my body. And it was a very overwhelming day for me. I mean, I was 18, I was not a baby no more, but still it was something really hard for me because it's something that I have to deal with my entire life. So even though it's something that I'm going to have forever, I still manage well. The pain now that I'm older, it's not bad like it used to be back then. But I mean, still in my body, there's nothing I can do about it, but I try to keep a positive of mine about it.
Great. Thank you, Linda, for sharing your story as well. I'm interested to know, and I'm sure the audience is, for both you and Brittany, how was this information received in terms of your family and your immediate community, in terms of what the rare disease was, what you were living with, and some of the symptoms and side effects that you were experiencing, probably from the medications you were on? Brittany?
Sure. So it was, for my family, as you can imagine, there was a lot going on. There was a 2-pound baby in the NICU, and then I was in cardiac ICU, and we were just trying to figure out what happened. Heart disease or any type of heart illness did not run in our family. Just nothing as extravagant as heart failure. There was high blood pressure. There were things like that, but nothing that literally could have killed you immediately. So not only were we learning about this new rare disease that I had, but I also have a 2-pound baby in the NICU. And, at this time, it was my husband and I, of course, and my parents and his parents, but we were married in October of 2009, and my son was here in September of 2010. So we were just now, we didn't even know if we liked each other yet. And we were still just trying to deal with that part of it, let alone dealing with a new NICU baby and my diagnosis. So I am my parents' only child. So for them, that was scary because they're thinking I could lose my child and my grandchild. So they were at the hospital 24/7. They would get very frustrated every night when they would get put out of the CVICU. They would say, "What do you mean it's closed? She's still in there, so I need to get in there." But it was scary, to say the least, because of course we go to the doctor and they tell us, be careful of this, be careful of that, especially when it comes to pregnancy. I think most women know some of the general risks, like preeclampsia and stuff like that. And I've heard older women say, when you have a baby, you've got one foot in the grave and one foot in the bed. Real life truth like that is not a joke. And because it became reality so quickly, because not only was Micah 2 pounds, he was taken 6 weeks prior. So we weren't ready for any of this. So I went from, I was at work on Thursday. Friday, they admitted me into the hospital. Saturday, they induced labor. Sunday, I had a premature baby, and Monday, I had heart failure. Wow. It was not, and for my family, I can't even imagine how overwhelming it was. For me, it was a lot because I was in ICU. I couldn't go and see my newborn, but I was pumping milk and sending it to the NICU. And they were bringing me blankets of his back and so on and so forth. So it was definitely an adjustment that I don't think anyone should ever have to make. I think it was something that that even the hospital wasn't very familiar with. You could kind of tell that they were trying to figure it out as they went along, not necessarily the condition, but all of it happening at the same time and trying to make sure that everyone was healthy and happy.
Right. Before we go to Linda, did you find that you were able to get some of your questions answered, general questions? Again, it sounds like they were trying to figure things out as they were also building the ship. But were they responsive to you and your family's questions and concerns about you and the newborn?
Yes and no. We did have some issues that that arose initially. To be very honest, the first hospital that I went to because I was released to go home because they thought everything was okay after I had Micah. So I did go home, and when I got home, I felt like someone was lying me down underwater, and that's what made me go back to the hospital. And the hospital that I went to was in a very small town. I live in a very small town. So when I got there, I told them I can't breathe and something's wrong. And before even assessing me correctly, the nurse simply said, "You're having a panic attack. Just sit down. You're having a panic attack." There was no, let's at least get a blood pressure. Let's get an EKG. Let's kind of see where you are and how you're doing. I was an African-American woman that had just delivered a baby on Medicaid, and I was told to sit down.
Interesting.
So that was disheartening, but I actually did. I went home because I said, maybe he's right. Maybe I am just overreacting. And I can't tell you, Beverly, how many stories I've heard since I understand and know what peripartum cardiomyopathy is now. I can't tell you how many stories I've heard of women like that have gone home and not made it back to the hospital.
Yeah.
Because someone told them, oh, it's just anxiety, or, oh, your uterus hasn't shrunk yet. So you're just, and nobody's actually listening to the patients and to the patient's symptoms. So I went to the hospital, to the bigger hospital farther up into Texas, and they did admit me. But initially they actually admitted me. It was a Caucasian physician, male physician, that readmitted me. And he said, "I actually think you have pneumonia. I don't think you have heart failure." And I said, "But my lungs are clear." He said, "Yeah, but it's probably pneumonia, and it's just, I'm going to treat you for pneumonia." So he was actually treating me for pneumonia for about 4 hours. And then my obstetrician actually called to check on me. She said, "I know there was a lot going on with the baby. I just called to check on him." And I said, "Well, I'm back in the hospital with pneumonia." And she was like, "You have pneumonia?" And I said, "That's what they said. My lungs are clear, but that's what they said." And she said, "Well, I'm gonna come check on you." So she put on her street clothes and she came and looked at me and she said, you don't have pneumonia." So she said, let's see what we can do. So she went and talked to that other physician, and they transferred me to her service. And immediately things changed. And I had an African-American female gynecologist and obstetrician. And she was like, it's not classic pneumonia. And I understand putting a label on it to get you treated, but that's not what we're going to do in this situation. So she took me to the OBGYN floor. And the first thing she said, "I'm going to have a cardiologist come and look at you because I think this may be a very rare condition, actually, called peripartum cardiomyopathy. But the first thing we're going to do is I'm going to take you to the NICU to see your baby boy."
Wow.
So we went and saw him, and I loved on him for a minute. And she said, "Okay, now we need to go take care of you." So we went back to my room and they did the echocardiogram, and lo and behold, my heart was only functioning at about 20%.
Wow. Wow. Well, Brittany, I think it's amazing. And I hope I can call you Brittany.
Yes, ma'am.
That you are here with us today. And I know we're going to delve in a little deeper in terms of care and our healthcare communities and how they respond to rare diseases. But I think it's a miracle and a gift that you're here because your story hopefully can help someone else.
That is my hope as well. Thank you for having me.
Yeah. So at this time, I'm going to segue to Linda so we can hear from you, Linda, on how your community, your family responded to your having a rare disease.
Okay, so I'm gonna be very honest with you. Since I started having this when I was only 13, I was pretty much embarrassed like my whole life until now. So usually whenever I started having these things, I would just talk with my mom or my grandma, but like no with like the rest of my family. I mean, I was just 13. I didn't know what was going on.
Right.
So whenever I got diagnosed when I was 19, the only person that was with me was my mom. So she was like the first one to knew what was going on. And when we were talking with the doctor, what was this rare disease about? It was pretty overwhelming for both of us because I feel like my mom was like ready to find something to like help me, and I was too, because I mean it took so much from me mentally when I was in high school. Of course I was not feeling comfortable around people. Like, it's summertime, I'm not going to be able to wear this kind of clothes.
Yeah.
Or sometimes I would go to hospitals and people will make me feel bad because I have these things, and it was just like, I'm sorry, but I can't control. Because I used to go to the urgent care multiple times, and sometimes I will get the same people, and it was like, oh, you're back. I'm like, yeah, it's a problem. Sometimes you can meet that kind of people, but of course I was there because I needed help. Mom couldn't help me at home. So whenever they told us what was going on, of course my mom was there. We came home and we were like, what is this? They gave me like 20 papers of information, and I'm like, no, I've had enough today, because I was crying with the doctor whenever they told me my disease, and when they told me, I'm sorry, but you're gonna have to live with this forever. And I was like, no, are you kidding me? And he was like, no. And then he explained it, everything, and I was like, wow. Like, I was hoping that I was just gonna come like to that hospital to get good news, which they were good, because half of it was like, okay, now I know what I have finally, but not what I was expecting. So I do share what's going on just with my family, not with my friends or my community. And I feel like that's because I'm like very scared of what people is gonna think, and they're just not gonna make me feel comfortable. So usually I just talk things with my mom or my sister, because I have a twin sister. So whenever I'm not feeling it, or I'm like going through something hard, then I would just go talk to her or my doctor. But then not people like, it's not mom or my sister or my grandma, but then that's it.
So was your doctor helpful in helping you and your family get educated about your rare disease?
Yes, ma'am. He was actually really nice. So they transferred me to the cancer center in Chapel Hill, about 2 hours away from here. So they do have a lot of people with the same disease that I have. So he has a lot of knowledge about this. When he saw me, not even 5 minutes, he was like, oh, I know what is this. I'm like, yay, finally somebody knows what I have. So yeah, he gave us a lot of information. Like I said before, he gave me like 20 papers, but I didn't even read the papers. I was like, nope, this is going to the trash. I had enough today. It was just very overwhelming for me.
I can imagine at 13 it would be. And, not even knowing what this rare disease is, never hearing of it. So I could imagine it would be very scary for you.
Yes, ma'am.
One of the questions that we have is, that I have for you and Brittany is, can you share any examples you've seen of effective community initiatives to support underserved populations with rare diseases, rare disorders? Any examples you've seen of effective community initiatives to support underserved populations living with rare disorders?
I personally have not necessarily seen any community initiatives, but I have done several listening sessions and focus groups that were based at Vanderbilt University around understanding this rare disease better. And that's something that I really enjoyed and felt heard and seen in, because it wasn't a coalition or a focus group on heart failure. It was specifically on this type of very rare heart failure. So not just having them bring those people together, but having them bring us together and having us, and I don't want to say validating our experiences, because obviously our experiences are ours
Right.
and don't necessarily need the validation, but to see all of these other women and say, I am not crazy.
Mhm. And you're not alone.
And I'm not alone. Exactly. I am
Alone.
not crazy. I'm not alone. There are other
Exactly.
people that are actually surviving through this.
Yes.
And even on my worst days, I can survive as well. So like I said, it wasn't necessarily a community initiative, but they are doing a lot of footwork. So with them, these companies hire them that want to put these initiatives out, and they're gathering the information from us as we go through the experience. So I'm not sure of what initiatives they are fueling, but they are definitely paving the way to what I believe is going to be some great, great work in the future.
That's great. Can you share any, so how can rare disease advocacy organizations identify and reach out to more diverse patients? I think from both of the examples that you and Linda are giving, you are dealing in a situation that's, inherent to you and your family. But I'm sure, as you've mentioned, Brittany, there are so many women out there, and men probably, who have rare diseases that feel isolated, feel alone, and don't feel connected to any advocacy organizations. How can rare disease advocacy organizations find diverse patients? Any ideas?
Before I answer your question, can I ask Linda a question? Is that
Sure.
okay? Linda, have you ever done any focus groups or kind of like listening sessions with other people that have your condition, or been in any groups like that?
Yes, especially with people who's closer to my age or like even younger. I have done like a few of things online where I have like my own space, and then I can like do little vlogs about how I'm feeling or how everything started. I recently did a video for the people who's giving me medicine, and I also have a Facebook group. So they added me to a Facebook group, and there's a lot of people that have the same disease that I have, different ages, color, woman, man. And so we kind of talk about everything over there, like giving us advice to each other, like, no, don't use this, or no, use this. But yeah, I have done a few things. Yes.
That's awesome. That's awesome. To answer your question, Beverly,
Sure.
I think it's little things like, kind of like Linda said, like Facebook groups and things like that. I think the best way to do what you're referring to is to kind of meet the people where they are, if that makes any sense. Everybody has some form of social media, or know somebody that has some form of social media. So even if I may not have, a Facebook or an Instagram, someone that knows my condition does, and will say, hey, did you know that there's, a company looking for people that have your condition, so on and so forth. So I think the best way for those companies to advocate and really get some information or put some things out there is to meet us where we are. And I think we're on social media, and obviously we're in doctors' offices. And I'm very surprised at how little information I see about rare diseases in hospitals and doctors' offices. There's not. I would expect to find a library of sorts for these types of things. And even now, walking into my hospital, knowing that I have this rare disease, Linda, knowing that you have this rare disease, like, do you ever see any like pamphlets or anything about the disease that you have? Never.
No,
It's like we don't exist, right?
Yeah, I do see things on like Facebook sometimes, but just from like our group chat, but not like from like other people. Like people has no idea about my disease either, which is really hard. Because sometimes
so
you try
Linda,
to explain them.
say your disease again for those in the audience who didn't hear it the first time.
So usually people just say HS because like it's very hard to pronounce it. It is hard for me too, but it's hidradenitis suppurativa, something like that. I don't know. It's really hard to pronounce it.
Yeah, well, that speaks to how rare it is, right? Even the pronunciation is rare.
Yeah.
One of the things that I found when I was in the sickle cell community is that community health workers were really instrumental in helping us not only find, but connect patients to advocacy groups, and to help them feel not only validated, but affirmed. And knowing that there is someone who's trusted coming into the home or connecting with you via Zoom or phone was a great way for rare disease individuals to not feel isolated, which I think is some of the, I made a list of like some of the common things that I would hear about, and isolation was a big one. Is that something that Linda or Brittany, you felt or experienced? So
Yeah,
did you feel any isolation or alone?
well, I was not feeling alone. I was just scared of what other people was gonna think about me because I was a young girl. So I was just scared of what people was gonna say about me. They were not like giving me like negative stuff. They had no idea. Like I had friends that they had no idea what I had, and that was because I was always hiding my disease like 24/7. Like if they will invite me to go over somewhere where it was gonna be super hot, it was like, nope, I'm not going because I know they're gonna notice something weird in my body. So no, it was just more because I was scared of what others were gonna think about me, not because they were like giving me signs of,
Right.
like they're gonna tell me something wrong, even with my own family. Like I didn't feel comfortable. And it was just like something in me, not because of them, but because of me.
I absolutely felt isolated, and it wasn't necessarily, as Linda said, everyone in my family kind of knew what was going on. I did have a pretty wide social media following, so a lot of people, well, at that point it was really just friends, but I did have a large group of friends, so they knew what was going on as well. But and people understand having a baby, so they kind of rally around you in that time. They want to celebrate with you, they want to do all these things, but people don't know what to do when it's a bad situation. So if you've been diagnosed with something, or God forbid you've had a heart attack or some other life-threatening illness, it becomes a very lonely journey, because instead of people saying, I don't know what to say right now, but please know that I'm here even if I'm silent, they just kind of fall away. And the loneliness in that, I think, is something, obviously I cannot speak for everyone in the rare disease community, and Linda, you can tell me if these sentiments echo with you at all. But sometimes I wanted the isolation because I didn't want to explain what was wrong with me. If that makes any sense. Linda, did you?
Yes, definitely. I mean, it is hard sometimes to explain people what's going on, and sometimes you don't even have the answers for it,
Exactly.
Yeah, makes a lot of sense.
Exactly.
So do you think that as an organization that supports patients and caregivers, can we promote diversity, equity, and inclusion and improve the healthcare journey for all? And I know that's a huge question because, like you said, Brittany, you can't speak for everyone living with a rare disease, but are there things that organizations should be mindful of and could help promote inclusion, equity, and diversity within the healthcare journey?
I feel like doing this, like me and Brittany, doing this, like this is a great example, because sometimes you only see one type of people and it's like, why them and not me? Like we have the same thing. Maybe mine is worse than hers. Like it is hard sometimes to like actually feel part of something, especially for me because I was not born here. So whenever I used to go to the hospital, I was like, oh no, I hope I don't get some mean lady, because sometimes they can be very mean, or because you have an accent, or, oh, you're not from here, what are you doing here? So I think that's very hard. But what we're doing today is a good example to like actually help others to like, don't be afraid.
Right.
Yeah, I agree with Linda wholeheartedly. I think things like this, I think taking us out of the dark, so
Mhm.
to say. I feel like society does not like anything that is different.
Yes.
So if we are able to say to society, Linda didn't choose this,
Mhm.
not who she chooses, what she chooses to live with. It's not something she chose to pick up and carry. I was not born a woman with heart failure. This is something that happened along the way. And as we've all had things happen along the way, they may not be rare diseases or critical illnesses,
Right.
but every single one of us, just as humans,
Yes.
understand the alteration of life and how that can ostracize you from society at large. And unfortunately, right now, we kind of have a very unforgiving society.
Yes.
Linda.
I agree with you. Yes.
I would agree as well. I would definitely echo that.
We have an unforgiving society. So in that, it's trying to figure out how do I fit in,
Mhm.
but still feel like me. And understanding that I have all of these different things. For instance, I'm 37 and I'm back in the dating world. First of all, dating at 17 was a whole issue. So now let's try dating at 37 with a heart condition and telling people, listen, I'm immunocompromised, so we can go on a date, but you can't touch me.
Mhm. That's a whole different topic and a different webinar, right?
That's a whole different topic and a whole different webinar, and probably 5 other counseling sessions in the process. So yes,
But I affirm what you're saying, Brittany, because it is real. And I will tell you, one of the things I heard of often from patients living with sickle cell was that they were often misunderstood. You shared earlier, not believed by the healthcare provider when you're saying, listen, I know I don't have pneumonia. My lungs are clear, and they're like, no, that's what you have, or you're going to go back home because this is nothing more than what you think it is. Or in sickle cell, a lot of the patients were often escorted out of the ER because they were not believed and they thought that they were drug seeking. Are those types of experiences similar to things that you both have experienced when you were looking for care?
For myself personally, outside of what I described earlier, just being told, you just have anxiety, sit down, literally. And when they did get me there and got me settled, they pumped liters of fluid off of my body. So no, I was drowning. I wasn't having an anxiety attack, but because I guess that's where the word rare comes in, right? Unfortunately, so many of us with undiagnosed rare diseases don't even make it to the hospital because back to that societal construct of, I don't want to seem like I'm sickly. I don't want to be labeled as, oh, Brittany's always sick. Brittany never feels good, so on and so forth, which I'm sure sickle cell patients probably had similar experiences. So, and even now, there are times where if I don't feel well, I will wait till the very last minute to go to the hospital because number one, I don't want to be told, you're good. You just need to drink some water. No, I'm not dehydrated.
Right.
And then on the other side of that, it's not just the hospital, it's family and friends. It's, yes, I'm canceling dinner again, but it's because I can't, not because I don't want to. And I can't tell you how many times people have said, I'm so disappointed in you that you didn't show up for this, or that I was going through this and you didn't show up for me, and you blame it on like you not feeling well. People, I can't tell you how many times I've heard people don't feel well all the time. And that's kind of a gut punch, especially from people that you that you love and that you trust and that you hope understand that I didn't ask for this. I don't want to be sick. I'm sure Linda wants to go and run around on the beach with her bathing suit on and be like, here I am.
Yes.
Right?
Hang out with her friends, Linda.
Yes. And not even have to think a second thought about having to explain my condition to them.
Yes. Yes.
I have to explain to people all the time, oh, well, I have a port. That's why this, looks like this, or I have this, and that's why this looks like this. And having to explain my sickness it's an element of life that most people don't have to think about.
Yeah.
I have to carry a special letter when I fly so that I can carry special medication all of these other things that most people do not have to worry about. Linda's got to check. I'm sure you have to check the temperature. If it's going to be sunny, right? Like it's going to be hot. You probably can't just go stand out there and hang around. So there's these variations that we have to make. So take the alterations that we already have to make just to normal, good old life. And then add to that the people that we are hoping understand don't always understand. And a lot of times they're not willing to ask the questions to understand.
Do you think that's coming from a place of fear?
Absolutely.
Not wanting to know. Yeah.
It's coming from a place of fear, and it's coming from a place of inexperience. Because until, death is something we all understand as humans, until you have experienced death, you don't understand that sometimes you can just sit there and be quiet with the person, and that's enough.
Yeah.
You feel like you have to say something otherwise.
Yeah.
So it's definitely something that is a fear of just not being able to say or do the right things in the right moments. So they just kind of sweep it under the rug.
And I know, Linda, you talked about feeling scared to share what was happening with you in your, with your friends and with some extended family members. Would you agree with what Brittany's saying as well?
For me, whenever I have to explain to somebody what's going on, it's annoying for me. Like sometimes, like, why am I talking if this person is not going to understand anyways? I mean, it's going to make fun of me anyways. Like, it's going to tell me, you were just too extra, like, just chill.
Mm-hmm.
And it's hard for, like, to explain your feelings, your pain. It's just like, no, I'm not being extra, like, for real. I'm not feeling it today.
Right.
And it was really hard, even, like, with my family sometimes. Like, my mom will be like, oh, you just want attention.
Mm-hmm.
I'm like, ma'am, no, I have attention already. I'm in pain.
This is not the kind of attention you want.
That's why you don't want to talk your feelings. You do not want to tell people what's going on because they're not understanding you. So then what's the point of talking?
Mm-hmm.
That's why you're just like me. I just rather be in my room. You know what? I can understand myself. I know what's going on. Just me, myself, and I. That's more than enough.
Yeah, and you also talked a little bit earlier about, both of you talked about social media and the groups that you're a part of. Can you talk a little bit more about those groups? How did you find them? And how are they helping to provide support for you?
Well, when I got diagnosed, they gave me like these papers of like, if I needed help or somebody to talk with. That's how I found the Facebook group chat. And so I kind of made a few online friends, like we can relate to some stuff sometimes. But yeah, I found the group because of Facebook. And then people find me on social media because of my social media.
Okay.
So yeah.
Are you a part of any support groups?
Just on Facebook.
Okay.
Just on Facebook, yeah. And then I do the online writing stuff once in a while.
Okay. Okay, Brittany?
Same. I just I'm just a part of some Facebook groups, stuff like that. Nothing, especially with us as immunocompromised patients, we don't really get together that much.
Yeah, it makes a lot of sense.
We have like a transplant reunion once a year, stuff like that, to kind of reconnect and update email addresses and so on and so forth. But no, for the most part, we do everything virtually or just kind of work together in those communities in a way very similar to what Linda said, just saying, hey, I'm having palpitations. Anybody, anybody have any remedies that work for them? Or, when you drink Coca-Cola, does it give you palpitations? Is that what's going on? Or do I need to go to a hospital?
Yeah.
So yeah, that's kind of the same experience for myself.
Okay. So what advice would both of you give your earlier self in your journey? Anything you would tell your earlier self?
Don't get married and have a baby. It's going to kill you. Sorry. That wasn't it. Sorry.
I love your sense of humor, Brittany.
I'm sorry. You have to, right,
Yeah.
Linda? Like, you've got to have you got to have a place to put some of this stuff. Honestly, I would tell my earlier self, and I actually really thought about this question. I would have told myself that no matter what other people say, I am my greatest advocate. And I would have told my younger self that my feelings and my experiences are valid. Being heard is valid. Being heard is a part of our healing. I think when someone says for the first time, like Linda, when you walked in and he said, I know exactly what you have, just that feeling of, I'm not insane. I'm not crazy. The pain is real. The shortness of breath is real. So in that sense, just being your own biggest advocate and saying, no, I understand what I'm feeling, and this is what it is. And you may not be the right doctor, but I'm not going to change my experience to make you comfortable.
Yes. Great.
I can definitely relate to everything that you said. I mean, I was just 13, but now that I'm older, I'm like, wow, like I would have done things in a different way, like, like my feelings and mentally, but I was not prepared to going through everything that I've been going through. And even now that I'm older, I wonder, like, well, maybe I'm being too extra, maybe. Like sometimes I will believe what other people are saying about me, being extra, being too much, especially from my mom. But I mean, it is what it is.
And it's your experience, and it's exactly what Brittany also said, right? It's difficult when other people are, criticizing what you're feeling, because it's in your body. Right. And I think it's really, really hard sometimes for people to get that. That's your experience. And if you don't feel like going out, or you're not feeling well, or in Brittany's case, you don't feel like going on a date because this person is not going to understand, what you're living through, then so be it. But I think that is so key and so powerful when you talked about the importance of being your own self-advocate. And I saw that a lot in the sickle cell community. That empowerment came from self-advocacy.
And it's not always that we feel like it, I don't think, right, Linda? It's like, if I don't speak up for me, no one else understands my experience enough to be able to say, no, she can't go to the store, because, I mean, as physically painful as some of these things are and can be, the mental toll that it takes just to be a patient is so much.
Yeah. Yes.
So sometimes we don't feel like it just because we mentally don't have the space to function in a normal fashion and deal with the world today. And being in the room and being isolated is the only way we can, just to get to the next day where we do feel well. So even, being your own advocate even means that. It even means saying, I need a mental health day today, and I'm not going to do those things. I am going to cancel those plans, and I'm going to take care of me today.
Yes. I totally advocate self-care.
Yes,
advocate self-care.
Yes.
And one of the things you touched on, Brittany, that I do want to talk about a little bit about is, the psychosocial impact of living with a rare disease. And I know in the sickle cell community, I heard the word, I'm tired. I'm just tired of being sick. I'm tired of not being able to do things like other people, or, like you said a few minutes ago, I can't just plan a trip because there's so much additional preparation that I have to undergo to get ready for that trip that people
Exactly.
sometimes maybe take for granted or overlook. But can you
Absolutely.
both speak to that mental aspect of living with a rare disease for our audience and what that's like? And if you have had to use providers, because I know sometimes there's shame connected to getting help, but can you both speak to if that's something that you've had to experience in your journey?
I feel like sometimes it's really hard to control your mind and like what you're going through. I personally feel like I had more mentally damaged than physically. And that's because my mind will make me believe stuff about myself that I know they're not true, but still, those are the things that I'm not able to control. And it's like, I've had like very bad mental days where I look myself in the mirror and I'm crying and I'm like, why me? Why am I doing wrong for me to go through this? And sometimes you have so many questions for yourself that you don't even have the answers for it. And nobody has it, which it's really hard. Rare disease takes a lot of you mentally, more than you can imagine. Honestly, it takes too much, and that's what I tell everybody all the time. It's not that I'm in pain, that my arm hurts or my body hurts. It's just mentally, like I just don't want to do nothing today. And it's just really hard to like even explain it sometimes.
Thank you.
I
Brittany?
1,000,000% echo that. And it is so difficult some days to just mentally move forward, because this is not something that we are going to get over tomorrow. It's not the flu. It's not going away in 7 days. We've got to do this every single day for the rest of our lives. And we didn't ask for this. We didn't cause it. It just is.
Yeah.
And everybody else can put it down. Linda's mom can walk out of the room and leave the condition. My mom can walk out of the room and leave the condition. But we can't. Wherever we are existing, whether we feel great or terrible, we are rare disease patients, and our rare disease is with us 100% of the time.
Yeah.
And being aware of that, and being aware that our lives will be substantially different because we are patients first, is not only frustrating, but it does make you want to give up some days. It makes you want to say, it's just not worth it today.
Yeah.
But
as we're getting ready to wrap up, I wanted to ask both of you for any final words of advice, recommendations you would make to healthcare providers on ways they can help you feel included, seen, understood, and accepted.
I mean, I understand doctors can have long days sometimes, and nurses too. But whenever you see that person coming through the door with a, angry face, like it's been a long day, and then they give you like, bad attitudes, like why you came, like why just didn't stay home. I feel like whenever somebody makes you feel comfortable, then you're gonna feel comfortable with them. But sometimes doctors don't make you feel comfortable. So I personally now with my doctor, like every single time I go there, I feel comfortable 100%. Like I can talk to him about anything and everything because I know he's gonna understand me, and he's just not gonna be like, oh, you're just too much today. No. Like whenever somebody makes you feel comfortable and just tells you a few things about anything, can make yourself feel so much better, and of course comfortable around them.
Yeah, thank you, Linda. Brittany?
yes, very quickly, I think the best thing that I've experienced a doctor do is ask me a very simple question after because of course they come in and they kind of talk to us and tell us what's happening. The best question I was ever asked is, what question do you have about your body today?
Mm.
I think that means everything, because I have a million of them. Like, you're going to be here for a minute, but I appreciate you holding space for me to ask any questions that I don't trust Dr. Google with. And there are some days I may have a million and I may say, no, I'm good. And there are days I may have a million and I might ask you all a million of them. But it's because you are our only hope. We don't have anybody but you. So knowing that you are willing to help, to not just heal us, but help us to understand us, means more than you as a provider could ever imagine.
Yeah, of course. I mean, being there with them can make you feel like you're safe place. Like, yes, finally I can talk with somebody that can understand how I'm feeling.
Right.
So yeah, I totally agree with you.
Yeah. Well, I wanted to thank both of you for just being so honest and transparent with your rare disease and what you're living through. And I hope that the audience felt that they had a moment to walk in your shoes and to understand your experiences living with a rare disease. So thank you, Linda. Thank you, Brittany. Thank you, Nord, for this amazing opportunity to share what it's like to walk in your shoes.